I am Dr. P P Ashok, neurologist at Hinduja Hospital, Mumbai. Let us talk something about what you should know about epilepsy. Epilepsy is known in our country by various names like Mirgi, Daura, Kench, etc. etc. They all mean what I refer today as epilepsy. In India, in a population about 1 billion, 5 to 10 million people suffer from epilepsy. Roughly 0.5% of any population has epilepsy at a time. So if you have 200 people in your locality, at least one should have epilepsy. And therefore, knowing something about epilepsy for the public like you is very important. Why does one get epilepsy? Our brain is a complicated structure where millions of nerve fibers carrying electrical impulses travel from one part of the brain to the other. In this complex brain, anything which disturbs this brain currents can result in an abnormal discharge of electrical current, which instead of going through normal paths, go through abnormal paths, resulting in fierce, violent convulsions of the body, where the person can lose consciousness and fall down. If you look at our electrical system in our building, very often this electrical system gets short-circuited. So it's not a very difficult thing to decide in our own brain with so many electrical circuits going on. This to get short-circuited at some stage in our lives should not be a big surprise. But it does not happen too many times, and still when it happens, one experiences an epileptic fit. So anything which increases the electrical discharge from the brain can theoretically produce an abnormal condition called epilepsy. So why does one get epilepsy? Let us assume that in a classroom of, let's say, 30 or 40 people sitting and listening to a lecture, the ceiling of the room falls down equally to everybody's head. It is quite possible that one or two of these 30 people could throw up an epileptic fit consequent to the fall. We are in this case assuming that the ceiling has fallen equally on everybody's head. So what makes that person who gets an epileptic fit and others who do not get, what is the difference between these two? This difference is because some of our people's brains are very sensitive to any stimulus, and this increased sensitiveness provokes them into abnormal electrical discharge, getting a fit. So this sensitivity of the brain, a primary sensitivity to the brain, is what one inherits while you're born. Again, this doesn't happen in all the epileptic patients. A few of them, let's say less than 1 or 2% of the entire epileptic groups, have this problem of increased brain sensitivity resulting in epileptic attacks. Apart from this, the brain need not be sensitive, but because of certain damage to the brain, some injuries to the brain, or some irritation to the brain, again this electrical discharge in a normal brain can be disturbed by this happening. So the third thing is, our brain is not isolated from the rest of the body. The brain gets blood circulation, and in this blood it carries a lot of things like glucose under normal circumstances. Anything which disturbs the brain environment can also cause epilepsy. But that is not epilepsy. It is an acute fit, acute convulsion. For instance, if the blood sugar falls very low, the brain can get irritated because the blood that flows into the brain with low glucose can irritate the brain, and therefore you can get a fit. So in a diabetic patient who did not take any food but took the diabetic medicine, suddenly the blood sugar can fall and he can throw a fit. Similarly, in patients with kidney failures or liver failures, where these chemicals which are normally excreted or normally removed from the body by the kidney or by the liver, if they get accumulated in the blood because of either a kidney disease or a liver disease, all these chemicals get carried by the blood into the brain, and they can irritate the brain and can produce an acute convulsion. Please remember that the occasional epileptic attacks or convulsions that you get is not what I mean as epilepsy. Epilepsy is something which by definition has to recur, has to keep repeating. It may be once in a year, or maybe once in 5 years, or maybe 10 attacks a month. But the point is that in all these situations, it is not occurring because of any of the factors which I mentioned, like the glucose going down or kidney getting abnormal, etc. These are all spontaneous brain discharges which happens time and again, and that is what we call epilepsy. So why does one get epilepsy otherwise? Due to diseases? It can be due. The commonest cause in our country, unfortunately, is still due to birth injuries that happen. Most of our children in our country, still in the rural areas, are born through midwives or unqualified people in the art of midwifery. Most of these deliveries result in some injury to the child is born, and can result in some scarring in the brain, some injury to the brain. Many times, many of these children who are born, neither the mother nor the child ever knew or remembered such an abnormal birth injury. Till many years in their life, when they get the first time an epileptic fit, and then we do investigations, then we can trace it to a small scar in the brain occurred many years ago. So birth injuries is still common. Similarly, any head injury due to motorbike accidents can produce a scar. Brain tumors, slowly growing tumors in the brain, can produce as irritation of the brain. Or lack of blood, like a stroke, can produce a convulsion or a fit. Similarly, there are many such similar situations. In India, infections is a very common cause of epileptic fit. We have a lot of tuberculosis, so any TB affection of the brain can irritate the brain and produce fits. A still more common, which is very peculiar to our country and most of the developed countries, is because of our bad eating habits. We eat raw food in the roadside, which is uncleaned salads, and they are all contaminated with this eggs of worms, and these eggs of worms, called the tapeworms, if they get into the brain, they result in what is called a cysticercosis, and they can irritate the brain and produce fits. We have lots of examples of patients absolutely healthy, no other problem, they get a fit, and all that you investigate, you find is one of this neurocysticercosis or tapeworm egg in the brain, which is responsible. Similarly, there can be other causes which can irritate the brain and produce fits. What is essential to know is you have to recognize somebody who has epileptic fit. How does one recognize an epileptic fit? Most of these patients with epileptic fit do have some sort of a warning, and the warning is in the form of some vague headaches or vague unwell feelings, etc. After that, they get a typical aura, and the aura is the first symptom that the patient experiences before this fit comes. It could be some twitchings, in the eyes, or it could be some vague sensation around the lips, or a feeling of some vague sensation in the stomach. Many patients are able to tell you that every time I get an epileptic fit, I first experience these symptoms. And it is so precise that many of our patients or children are able to tell their parents that I am going to get an epileptic fit, so that the entire family can gear themselves and make sure that they take all the precautions to protect this child from injuring, because the fit is going to come very soon. Many times, some patients do not have such aura, and the first thing that happens is the fit. In such situations, it comes at abnormal situations in the road, it can be while driving a car, or it can be anywhere. Without a warning it comes, and these are the ones which often results in bad injuries to the patients. Epileptic fit, suddenly they start making a loud noise. The eyeballs just go up, rolls up. There's a clenching of the teeth. They start frothing from the mouth. The limbs get stiffened. And following that, within 1 or 2 minutes, the hands and legs starts twitching. And then by this time, they invariably have lost consciousness, and they fall down and either injure themselves. Some of these patients bite their tongue. Some of the patients pass urine at that time, because many of them whose bladder is full, and when they get this fit, they empty the bladder and pass urine. Some of these people even fall and even break their bones or dislocate their shoulders. Generally, in an epileptic fit, the loss of consciousness is for about a few minutes. After that, they start going into some sort of a deep sleep for some time, and then within about 7 to 8 minutes, they may wake up. When they wake up, many of them are very confused. They do not know where they are, and it takes about 2-3 minutes when they fully recover. During this entire period of this epileptic fit, which may be in some patients half a minute, in some patients 5 to 6 minutes, depending on the severity of the epileptic fit, most of these people, because they lose consciousness, they lose memory of the entire episode, which is what we call amnesia. So please remember that many of the epileptic patients who lose consciousness will never be able to tell you what happens to them or what happened to them during the epileptic fit. It is very essential, therefore, for the attenders and for the onlookers who are witnesses in epileptic fit, it may be your neighbor or it may be in your own house, to quickly click your mobile video, or at least make a good observation of what has happened, so that whenever this child or this adult consults their neurologist locally, they are able to tell them exactly what happened to the patient during this, and this will go a long way to help the doctor to make a diagnosis of epilepsy. Please remember, 99% of the times, the diagnosis of epilepsy is a clinical observation given to the doctor by the attendants and the onlookers. So it is very essential for you to have a good idea about what to see. There are also other types of epilepsies, especially in children, what is called an absence attacks, where all the child does is briefly the child starts staring in the class, all of a sudden drops the pen or pencil from the hand, and after 2 to 3 seconds the child is all right. Many a times these absent seizures are often mistaken by the teacher as being inattentive. If you are aware that such a thing could happen, you will be able to recognize that the child is actually suffering from absent seizures, and if they are taken to a neurologist who is able to diagnose it, and he can be treated, and what the students and the teachers and the parents thought is a inattentive child can be proved totally wrong, and the child can be totally functional and normal learning and doing well in school. For that, you should recognize that it is an absent seizure. Sometimes epilepsy can just be from the form of jerks like that, called myoclonic jerks. Sometimes you get epilepsy just in one part of the body and the patient never loses consciousness. These are called partial epilepsy. Just your thumb can just twitch like that for a few seconds, or the angle of the mouth can twitch like that, and it lasts for a few seconds or few minutes. It is very important to recognize this, because the fact that it is partial, that means one part of the brain is generating this discharge. Very often these patients have something in the brain, which is one part of the brain which is getting irritated. It could be a tumor, or it could be an infective focus which is irritating the brain and producing this. In these cases, it is very essential to investigate them properly. How do you diagnose a case of epilepsy? As I said, the most important diagnostic tool is the clinical diagnosis, which means the history provided to the doctor. It can be further confirmed by a test called the electroencephalogram, what is called the EEG. You all must have known about the ECG, which all of you are familiar, but EEG is what we do to the brain. We put electrodes on the scalp and record the brain activity, and those people with epileptic attacks, they generally have an abnormal discharge which can be recorded. Please understand that in less than 20% of people with EEG, with definite epilepsy, the EEG can be abnormal. In other words, an abnormal EEG means is definitely epileptic, but a normal EEG does not rule out an epilepsy up to 80% of patients. So EEG is only an additive tool. It's not a tool exclusive to say that it is epilepsy and nothing else. For instance, if you do a prolonged EEG for 24 hours or 48 hours, or you do more number of EEGs, the chance of increasing this 20% could go up to 60 and 70%. In other words, one routine EEG will not rule out epilepsy. That is regarding diagnosing epilepsy. But the diagnosis doesn't stop there. The next step is to find out what is the cause of epilepsy. As I mentioned, any scars in the brain which can irritate the brain doesn't need any other treatment other than treating the epilepsy. So your majority of your epileptic patients will be due to some scar in the brain which doesn't need any treatment. All you need to do is only to treat the epilepsy. But in a small group of patients, you may find a tumor, or may find a clot, or you may find an infection like a tapeworm or a TB focus, and for all that you need to do an MRI scan or a CT scan of the brain. We generally do in all people with epilepsy. Today we do either an MRI or a CT just to be sure that it is epilepsy because of a scar or epilepsy because of something else, because in that case we also need to treat that something else. How would you treat a patient with epilepsy? My first submission is 70% of patients with epilepsy can be completely treated and can be free of drugs after 2 to 3 years of treatment. It is only in the 30% of patients who get epileptic attacks despite medical treatment, despite one drug. You may need 2 drugs, you may need 3 drugs, you may need 4 drugs. These are what we call in medical parlance as intractable epilepsy. When we need more than 1 or 2 drugs to control epileptic fits, then we call it intractable epilepsy. Some of these patients will be worked up for surgery for epilepsy as a last resort. It's not the first resort, please understand. The first resort is medical management. We have wonderful drugs today, a lot of first line and second line and additive drugs which have gone a long way to treat many of these patients. Gone are the days when we had only few drugs which have got a lot of side effects. Today we have more and more drugs with less and less side effects, and which are more and more tailor specific to specific people with specific epilepsies. For example, women with epilepsy need special care with certain specific anti-epileptic drugs which are safe for their child, growing child, fetus. So there are a lot of drugs, and it's very reassuring that we have a lot of medical drugs. So once we put the patients on medical treatment, we have to observe them very carefully, and at least 2 to 3 years, 70% of patients become fit-free. Once they are fit-free after 2 to 3 years, and if the EG is normal, we plan a gradual taper of the medicines. Is epilepsy a treatable disease? Yes, the answer is it is a treatable condition in most of the patients. In a minority of the patients, we do find difficult to completely stop the fits, and resulting in partial control or near partial control of the epileptic attacks. How is an epileptic patient living his life? Does he have any special problems? Epilepsy is like any other illness. If you do not able to see clearly, you wear glasses, spectacles. Do you say that it is difficult to live in this world and read without glasses? What is the problem reading a glass? You live with glasses. Some live without glasses. But people with glasses also live. Similarly, people with epilepsy can lead a normal life, except they may have to take a few medicines and may have to take a few precautions. What are those precautions? The precautions are essentially that although you put them on medical treatment, they can still get a fit at an unwanted place. If you are driving a car and by some chance you get a fit, you could get a fit, and it can result in a very serious accident which nobody will forgive anybody. Or if you are swimming in a swimming pool, you can get drowned. Or if you are on top of a tree, as some people in the villages do, and you are epileptic, you could fall down. In other words, you should avoid doing anything with this epilepsy where you can harm yourself and sometimes harms others, like when you drive you can harm others on the road. So there are certain don'ts in people with epilepsy. But you can lead a normal life. You can go to your office, you can go to work, you can travel by train, you can go by bus, you can even cycle. Because under these circumstances, even if you have a fit, maximum you'll fall down and you may injure. That cannot be life-threatening. So that you don't allow these people to deprive them of all the routine life, living, work, job, etc. Life can continue for them. It's only the dangerous things that you should avoid. Can epilepsy patients get married? Yes, they can get married. There is absolutely no problem for a male with epilepsy to get married because there are no problems at all. For a lady to get married, there are some special problem which is solvable. Women with epilepsy, when they are married and when they haven't bear children, the medicines that you take can affect the fetus, the child in the womb. Some of these drugs which woman takes can affect the growing baby, and in that case can produce some birth defects. These are there, but very rare. With the newer and newer drugs that we have, all these complications can be reduced to a long extent. There are some drugs which are specifically safe to the mother, which can be easily given. And there are quite a number of them. So epileptic mothers can give birth to children. They can breastfeed the child without any problems. In short, people with epilepsy can lead a normal life. Thank you.